Good afternoon, and thank you for joining us. Today is Thursday, June 24th. On today's press briefing, we'll hear from Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department, and Darren Rausch, Health Officer and Director with the Greenfield Health Department. Dr. Weston, I'll hand it over to you to get us started.
Thank you, Catherine. Good afternoon. To provide a brief summary, we're currently seeing in Milwaukee County an average of 12 new cases a day, and we're seeing about 1 death every 2 days. We're at 0.9% positivity. That's a new low, and 32 patients currently hospitalized in the county with COVID. We're also seeing a bit of a decline in individuals seeking out vaccine. We're just over 800 people per day, slightly lower than what we were seeing a week ago, around 1,000. But we have vaccinated, again, 46% of our total county population and 37% of our high and moderate high vulnerability communities. I won't go into a full briefing, but I just wanted to cite one item that came through from the Associated Press. So they did a national level evaluation and found that greater than 99% of COVID hospitalizations in the country and greater than 99% of COVID-related deaths in the country were among those who were unvaccinated. And while the response to this may be that you don't think you'd get sick if you had COVID, it's important to remember that not a single one of the more than 600,000 Americans who've died from COVID anticipated that outcome either. So it's really hard to come up with a better motivation to go out and get vaccinated if you haven't already done so. So I'll stop there. I'll keep it brief and I'll hand it to Commissioner Johnson. Thank you.
Thank you, Dr. Weston. I want to start with positive news about our gating metrics. For the first time since we started to collect data, our burden rate has dropped into the low transmission category with 9.8 new COVID cases per 100,000 people. This is the lowest value for this metric on record and the first week that both our burden rate and percent test positivity have been in the low transmission category. Our test positivity is currently at 1%. This is absolutely worth celebrating. We know that the work our community has done to protect themselves and their loved ones is what has gotten us to this point, and we're grateful for the diligence in following safety protocols over the past 16 months. Our efforts continue as we keep an eye on other COVID variants of concern and work to get our residents vaccinated, but this is a huge milestone for the city of Milwaukee, and I want to be sure that we take a moment to celebrate it. Our vaccination rate is continuing at a slow and steady pace, with 46.4% of Milwaukee adults fully vaccinated and 52% with a single dose. Over the past few months, our vaccination strategy has shifted to meet the needs of our community, from mass vaccination sites to mobile clinics and in-home vaccinations. Now we're asking for the help of the community to increase vaccine confidence within their own networks. Community vaccination is an all hands on deck effort, and we're looking for Milwaukeeans who are passionate about spreading reputable education sources, being conscientious about sharing information about the COVID vaccine, and being culturally competent when they share that information. And we're asking them to join our ambassador program, the Crush COVID Crew. We've found that those who are still nervous about receiving the vaccine are most often comfortable talking to those they trust in their lives. So we want to encourage anyone who's interested in supporting our mission to vaccinate Milwaukee residents to join this program and help educate and reassure your friends and family members. The Crush COVID Crew will be hosting virtual information sessions next Tuesday, June 29th. There are 2 options to attend, one at 11 a.m. or one at 4 p.m. These sessions will provide information, tools, and resources from Milwaukee Health Department staff and other medical experts so ambassadors can feel confident when speaking to their personal networks about the COVID vaccine, debunking myths and misconceptions. Registration for the sessions can be found at the links on the screen, on the Milwaukee Health Department's Facebook page, or at milwaukee.gov/COVID toolkit. Any questions about the Crush COVID Crew can be emailed to crushcovidcrew@milwaukee.gov. The health department's vaccination team continues to show up with shots at events throughout the city. Tonight, assuming the weather cooperates, we'll be at the Downer Classic Bike Race, vaccinating spectators from 5:30 until 7:30 on the corner of Downer Avenue and Bellevue Place. Tomorrow, we're back at the Plaza at Fiserv Forum for the Bucks Game 2. We'll have vaccinations available before the game from 5 until 7 p.m. The Bucks have generously donated another pair of playoff tickets for that night's game, so everyone who gets their vaccine will be entered into a raffle to win. And Saturday, vaccines will be available at the Safe Summer Kickoff event at 116th and Jonan Street. And on Sunday, we're back at Summerfest for part 2 of their drive-through vaccination clinic. Summerfest is generously raffling off a prize package, so everyone who receives a shot at this drive-through clinic will be entered to win a 9-day Summerfest Power Pass, which is good for admission every day of the festival, and a festival merchandise package. The winner will be chosen on Monday, June 28th. The full list of mobile vaccination clinics can be found at milwaukee.gov/COVIDvax. Finally, tomorrow is Milwaukee Brewers reopening day, as American Family Field returns to 100% capacity for the remainder of the season. The health department has been working closely with both the Milwaukee Brewers and Bucks throughout this pandemic to ensure safety for their players, staff, and fans. And I am comfortable with this next step toward a version of normalcy. Just as a reminder, the CDC still recommends that any unvaccinated individuals continue to wear their masks while in public gatherings, and we strongly encourage fans to abide by these recommendations. If we want to continue to see our gating metrics trend in the right direction, we must continue to follow the CDC recommendations for safety and prioritize getting the COVID vaccine for ourselves and our loved ones. Thank you. With that, I will turn it over to my colleague, Darren Rauch.
Thank you very much, Kirsten. It's my pleasure to join today from the Greenfield Health Department and just highlight some of the data on top of what has already been shared with you today. 3 overarching takeaways from the data today include the fact that cases continue to decrease overall. We've seen very low case numbers recently, as evidenced by Dr. Weston's comment of 12 cases on average per week. These case rates continue to decrease to the lowest levels we've seen throughout the pandemic, and we're seeing those decreases not only in the whole population, but adults and children as well. As Dr. Weston mentioned, the data continue to indicate that cases, especially hospitalizations and deaths, are more likely occurring in unvaccinated individuals. And while we don't have that data yet to paint that picture, the anecdotal data that we get from our disease investigators and contact tracers is showing that. Secondly, despite the low number of cases for the past week, we still are seeing several individuals who have serious complications. And Dr. Weston hit on this just moments ago. We're reflecting in our epidemiology data that I'm going to share momentarily 46 hospitalizations within the past week, 31 within the city of Milwaukee, and 15 in the suburbs with 1 death. And for kids, the data reflects 9 total cases within the past week with 4 hospitalizations and 0 deaths. So I share these data to point out that while the case numbers are low, those individuals who are getting disease are having some serious sequelae as a percentage of the total population. And lastly, we continue to see and we continue to highlight disparities in our COVID data by race and ethnicity. And this sadly continues to be part of our COVID story. We see this both in cases of disease as well as in the vaccination data. So with that, I'm going to go ahead and share the data quick and highlight a few of these things. So what's on the screen before you here today is looking at the daily number of COVID cases and the 7-day trends in the orange line for the city of Milwaukee and the blue line for the suburban communities. And again, we have seen very marked decreases over the last several months, little blip in April compared to where we were at our peak, but very, very low cases. And again, this is in the whole population throughout the county. Now switching to looking at the kids report, looking at children under the age of 18. And again, peaks were a bit higher as a percentage of cases in children for a period of time this spring, but continued downward trends in those 7-day averages to effectively near 0 cases. Like I said, 9 cases in children over the past week. Now going back to the full county report, as Dr. Weston mentioned, deaths are very, very low, and you can certainly see that reflected here. We're seeing about a case every other day that is passing away due to COVID, and this is a much different picture than we've seen throughout the duration of the pandemic, when in the early months and even back in this winter, we were seeing large numbers of deaths as a proportion of cases. As we continue on in the report here, we look at the reproductive number. And again, last week I flagged that we were above 1, which looked like we were having more active transmission of disease in the community. But certainly this week we're reflecting lower transmission rates that have lowered to 0.97 in the city of Milwaukee. So a little bit below 1, but certainly trending in the right direction. And even a little bit lower in the suburban communities at 0.76. So we want to see that transmission number stay very low. As we've mentioned in the past, obviously, a lot of the disparities in the data remain pretty consistent when we look at race, ethnicity. I won't highlight that data today because we really haven't had a lot of cases to change those trends, but that continues to be a very important part of our story. I wanted to flag here for you looking at testing, and testing capacity is certainly existent around the county. Certainly in the days of our peaks back in October and November of 2020, we had nearly 50,000 tests occurring per week in Milwaukee County. And more recently, over the last 4 weeks, it looks like we're averaging more around 10,000, 11,000 tests a week. So again, there is capacity if you need to be tested, if you want to be tested. But even with those tests that are being done, as has been reported by both Commissioner Johnson and Dr. Weston, we're seeing very, very low percent positivity numbers and trends that are flat to decreasing. Lastly, today, I'll just highlight the spatial map looking at where cases are occurring over the last week. And again, cannot underscore enough that these numbers are very, very low, but the areas that certainly have more cases as a percentage in the census tract data, when we look down to neighborhoods, are the areas in red and orange. And again, this pattern is something that we've seen for a long number of weeks. But again, when you look at the cases in these deciles, we're looking at 0.3 to 0.7 cases per 1,000 people, again, reflecting the fact that our cases are very, very low overall. And I regret to inform, unfortunately for this week, again, we're still having issues getting data about vaccination. So the vaccination report that you've come to receive on these briefings has not been available for the last couple of weeks. We're currently working with the Department of Health Services to get that data. But as others before me have talked about, we are continuing to see slight increases in that percent vaccination, both with first dose and second dose. And that's a very, very positive finding. To end today, I want to talk a little bit about our low case rates and reasons why we're having low case rates of COVID-19, just to kind of put this in context for where we are and where we need to be. And again, I don't want to underscore any of the things that I've shared or Commissioner Johnson has shared or Dr. Weston has shared as not positive news, but I want to continue in these comments to reflect that there's still more that we can do. So as you've heard me say and others before, we know personal choices have had a large impact in the tide of COVID-19 over the past several months and over the past 16 months of the pandemic, quite frankly. Actions like masking and washing hands and maintaining physical distance were very important then, and they're still important now, especially things like hand washing, which are just good old-fashioned ways of preventing disease. Secondly, we know that vaccination provides a long-lasting immunity against COVID-19. That's why we continue to stress vaccination and encourage vaccination throughout the community. This is also why those people who are vaccinated are subject to less recommendations about masking. As a vaccinated individual, I don't have to wear a mask in public places, but I may choose to do so in crowded public locations, either indoor or out, to continue to keep myself safe. Now, speaking as a parent of 3 children between the ages of 9 and 16, 2 of my kids, both of my sons, are fully vaccinated, and it's been over 2 weeks, so they're fully protected. But I have a daughter who turns 10 tomorrow, and she's not eligible to be vaccinated yet. So I will, as a parent, continue to mask in public places to be supportive of her and encourage her in wearing a mask by showing good behavior and good personal choices. Thirdly, we know that COVID disease provides some immunity, and this has been something that people have said in the past. Well, I had COVID disease, I'm protected. Well, quite frankly, the immunity from disease may not be as strong and may not last as long or provide the duration of protection as compared to the vaccine. And even more, quite frankly, with disease rates declining in recent weeks, the proportion of the population who's had COVID disease that would be protected and immune continues to shrink. It's not like the old days of my youth when parents might have held vaccination or chickenpox parties to expose other kids to chickenpox. Quite frankly, there just isn't the disease to get exposed naturally. So we want to continue to stress personal choices and vaccination are the best ways that we can build community immunity, also known as herd immunity, in our community. We know that our current levels of community immunity are not at a level that is eliminating or reducing COVID-19 on its own. Remember, our goal is to get to 70 to 80% vaccinated, and we're still just slightly below 50% for first doses here in Milwaukee County. And yes, we're continuing to make progress, and Commissioner Johnson has outlined several great opportunities for Milwaukee County residents and others to get vaccinated here over the weekend, and that's great. Thankfully, we're also in a situation now where it's summertime in Milwaukee. We have warmer weather that leads more people to gather outdoors and spread less disease in indoor environments. We also hope that many people over the last 16 months have changed their behaviors to lessen disease transmission. So really, folks, in conclusion today, I just want to make sure that we're not resting on our recent successes and resting on our laurels, and we continue to push forward to get vaccinated, to encourage our families and friends to be vaccinated. As Commissioner Johnson said, if you want to join the Crush COVID crew and be a champion for vaccine, that is a great thing to do, and I would encourage everyone to do that. So with that, thank you very much for your time and attention, and I'll now turn the briefing over to Catherine.
Thank you, Director Rausch, and we'll move into the media portion of our briefing now. Our first question comes from Rebecca Clough with TMJ4. It's for any of our health experts, but perhaps Dr. Weston, you can jump in first on this one. She's looking for an update on the latest cases of the Delta variant in Wisconsin and Milwaukee.
So we can probably look to national data for the most accurate source of the Delta variant. There is continuing rise in Wisconsin when we look at the state lab of hygiene data, although the national data is very informative and very up to date. And that shows that about 20% of new cases of COVID in the United States are from the Delta variant. That's a big jump. I think it was just last week we were talking about around 10% of the cases. So we've already seen a doubling in just that time. And if we look to other countries, if we look to the UK, if we look to India, we would expect probably within about a month or a little more than that to see it be the Delta variant or the predominant variant in the United States. We see the same in India. We see the same in the UK. Russia, which is having a major surge right now, 90% of their new cases are the Delta variant. So certainly a very concerning variant with its high rate of transmission.
Thank you, Dr. Weston. Our next question is from Rose Schmidt with CBS 58. Perhaps Dr. Rausch, you might be able to comment on this one. Director Rausch, State Fair announced updates today, such as new hours and a cashless experience. They also said masks will not be required. What do you think the vaccine rates will look like by August? And do you hope they will increase by then?
Yeah, it's hard to see. That's a great question. It's hard to see changes in the vaccine rates unless you're really digging into the data every week, like myself and Dr. Weston and likely several other public health colleagues are. What I'm seeing on my end, Rose, is we're seeing an increase of about 1% a week, both in the percent of folks here in Milwaukee County who've received their first dose and the percent who've received their second dose. So those numbers are moving up, but certainly they're moving up at a much different pace than they were back in March and April and early May. I think it's likely that we're going to continue to see that increase. You know, any increase in vaccination rates is very positive. I can't quite figure out here while I'm talking to you how many a percentage point a week will be by the time State Fair starts in August, but certainly we're moving those rates up. And I think every opportunity to provide vaccine is a very important very important thing. It is really moving us to that target.
Thank you, Director Rausch. I think Rosa's second question could be answered by Commissioner Johnson. She asks, can you talk about the importance and effectiveness of holding vaccine clinics such as the one you're holding with the Bucks tomorrow?
Sure, and I think just to Director Rausch's points previously, it's really everyone we vaccinate is one more person who's protected, and we're really trying to build that immunity in our community. So again, these events, especially the incentivized events, are encouraging for, the Bucks in particular. We're targeting a younger population. We're also doing a door-to-door effort on the Northwest side right now. But, as we'll continue to do all summer, I think we really, again, now is the time to get vaccinated because we know the Delta variant will be here soon. I mean, it's here in Wisconsin, but that's likely to spread. And we want to protect as many people as we can.
Excellent. Sharon Bajenda with CBS 58 has two questions. Perhaps we can tag team this. Director Rausch, maybe you could take the first one, and Dr. Weston, the second one. The first question is, with many aspects of life going back to normal, how do you foresee the future of mask wearing from a public health standpoint? And do you think people are more willing to wear masks during upcoming cold flu seasons?
Yeah, that's a good question as well. I do think that mask wearing, as we've seen it over the past year, really contributed to next to no influenza season over the past year. We see that in the numbers. In all of my years and in my career, I've never seen influenza rates essentially be flat throughout the year. So I do think that masks, physical distancing, hand washing, those personal responsibility and personal choices that I talked about earlier made a huge difference in that regard. Now, whether or not that will, lead to people wearing masks at other points of the year and going forward is really, really hard to tell. I know people who were more than willing to wear masks, but I also know many people who were just like, I'm only wearing this because they're telling me to. So I think the jury's still out, but I certainly think from a public health and a medical standpoint, and I'd love for Dr. Weston to weigh in, it does make sense. We've seen prolific mask wearing in other countries during flu seasons in the past. And certainly if that was to take hold in the United States, I think it could lead to the significant decrease likely in lots of respiratory diseases during the winter months.
Yeah, I would agree. Influenza hospitalizes many people each year. In most years, it kills many people in most years, not anywhere near the numbers that we're seeing and have seen with COVID. But nonetheless, a lot of people are negatively affected by influenza. So I agree with what Director Rausch said. I don't think that we'll never get back to a sense of normal. I don't think we'll be wearing masks in every aspect of our lives for the future, but I think there's certain settings, certainly healthcare settings, hospital settings, especially during certain times of the year where mask wearing, perhaps some level of distancing is going to be helpful to help with other diseases as well.
And you just touched on her second question, but just to clarify, do you think mask wearing will be required at hospitals at some point?
For some time. So I think certainly for some time, masks will be required at hospitals, if for no other reason, because we have, number one, a large portion of unvaccinated individuals. And I think number two, because even is for some people who are vaccinated, if they have severe immunocompromise, potentially a reason why they're in the hospital, they're at much higher risk. And then there's people out there who simply cannot get vaccinated. They're few and far between, but there are people on certain cancer treatments, for example, who are unable to get vaccinated at this time. And those people are in hospitals quite a bit. So I think for the foreseeable future, mask wearing at hospitals will continue.
Thank you, Dr. Weston. Those are all of the questions I'm seeing in the chat. So at this time, that does conclude our briefing for today. Maybe we've got one more. Sorry about that. All right. So Rose Schmidt with CBS 58 is wondering, from a health perspective, how do you feel like COVID-19 has changed the way large events, festivals like State Fair operate, especially as we look at policy changes such as going cashless and increased sanitization? Are these positive changes?
I can start. I think they are positive changes. I think one silver lining of COVID is putting, frankly, public health front and center and public health practices, which apply to our lives far beyond COVID as well. And so whether it's frequent hand washing, whether it's sanitizing high touch surfaces, not necessarily for COVID, but for other diseases, cashless payments, some sort of distancing in certain events, I think it has made the public as well as institutions more aware of ways to pursue and encourage public health measures. And that's certainly a good thing.
All right. At this point, I am not seeing any more questions in our chat. So that does conclude today's briefing. Thank you all for joining. Thank you, media, for the questions. And we'll be here next week on Tuesday. Take care.
Thank you.